And welcome back to our Imagine Futures conference by the Sexualities for the Center for Sexualities, AIDS and Gender and the Just Leaders program. Right now, we're about to enter a panel discussion with three phenomenal people. We've got Danai, we've got Tuti and Noma, who are going to be sharing on sexual and reproductive health and rights. And we're going to have a discussion regarding what has happened during COVID and some of the work that they've done in their fields. I'm going to read out their bios. On the first end, we've got Noma Pakade. Noma Pakade has extensive working experience in community mobilization and advocacy within the NGO sector, a committed, knowledgeable, and capable researcher who has published in theoretical experimental work on gender and sexuality and governance in the education sector. She holds an MA in research psychology from the University of Witwatersrand. Currently, she is a doctoral candidate at the Department of History and Heritage Studies at the University of Pretoria. Noma is also the co-founder of the Simon Ngoli Collective. Welcome, Noma. And the next person who's going to be joining us is Tuti Jabulani Madlingozi Blondes. Tuti is an independent consultant with over 18 years of experience of working with community-based projects and the non-profit sector. She has worked closely with young women in training, skills and development, and training with the goal of ultimately inspiring their confidence. She currently trains, coaches, and mentors women to develop and expand skills to be employable. Tuti has developed strategic programs for young people, as well as migrant and refugee women living in South Africa. Her facilitation and research skills include expertise in gender and sexualities, gender-based violence, sustainable development, and economic inclusion. She has also worked as a research and facilitation consultant for various local and international organizations. Thank you for being here, Tuti. And last but certainly not least is Danai Mupotsa. She did say she has an 18-page CV, so please email me that later. But for now, this is what we can share. Dr. Danai Mupotsa is a senior lecturer in African literature in the School of Literature, Language and Media at WITS. Her research interests are race, sex, gender, and intimacies. In 2020, she published the Portuguese translation of her debut poetry collection, Feeling and Ugly, and recently co-edited The Time Out of Joint, The Queer and the Customary in GLQ, a journal of lesbian and gay studies. Mupotsa is a 2020 Atlantic Fellows for Racial Equity. Thank you so much all for joining us today. We look forward to hearing what you have to share based on your experiences, and please do take it away.
Thanks, Danai.
Thank you.
So I get to, it's an incredible pleasure to be here, and also on the panel with two people who I find, whose work I find incredibly powerful, meaningful, important in this arena, and who Tuti and I have been long-time collaborators, and Noma and I have only sort of very recently started to think through these questions together, so this is a tremendous pleasure. I'm going to play the kind of role of Oprah Winfrey. I'm going to be the Felicia, yes, the younger version, so keep the conversation going. But I wanted to first start with an opening set of questions, I guess, or provocations from Tuti. Tuti and I have known each other since 2005, and at that point you were working in various projects, and we collaborated together on a project Sienza, which you conceived of based on a set of, maybe you can say something about what that project was and how it relates to the set of questions for this panel today.
Okay. Hi everyone, I'll do that. When you talk about 2005 and now in 2021, it feels like I'm really old, but that's okay, it comes with experience as well. And the project Sienza, I guess it was a passion of mine. It was a community-based project that was in Guguletu and the neighboring communities. And I started Project Sienza because of my educational background. I felt like in the communities, there were still young people, even though it was 2005, that needed still direction, they needed support systems. So I worked with these young girls who were between the 15 years old and 19 years old, where even though they were coming from these good family backgrounds, but they were girls who were uncomfortable to communicate with their parents. So luckily I met Danai then, and I could bring her also educational background, and we worked with these girls facilitating different workshops and trying to see how we can, how we can build and restore them. Not that they were broken, but they obviously needed direction. But it was important for Danai and I to hear first from them and not to come in and just say, these are the solutions. So, and also, the reasons why I started Project Sienza, because I worked at UCT with women who obviously were abused. I was part of the research team. And I was very young then. I felt like if you could just empower young people and to know which partners to choose, or at least to be aware of the existing services they could attend to, maybe I could do, there could be some difference and they could be more aware. So I guess that's the reason why I started Project Sienza.
Okay, and then now you've had this vast experience in terms of different kinds of projects, and so maybe you could share some anecdotes, some experience or some insight, because I get the sense that often, I think in the broad sense of things and thinking young people's sexuality, there's generally a premise of alarm as the one we were never young ourselves, or also, but there's also a particular ways, and so a lot of the ways that you've worked has been to think about the knowledge, capacity, expertise young people have of their own lives, their own worldviews, and what it means to speak from those orientations, from that space of orientation, because a lot of the time young people are intervened upon as though they already, before they even open their mouth, were a problem. And so I think there's something about the way you've tried to approach the ways that you facilitate. So maybe you can give some insights or some experiences around what would it mean long-term, how we think of young people's sexualities in general, but also COVID-19 and the fear now of, I always say, like you walking around as a young person just fearing teenage pregnancy like it happens, like it's a noun. And so, yeah.
Even before I start sharing all the experiences, what is said about in the past 2 years, how our young people, the statistics have increased, because this has happened even before pandemic. So I'm not sure why would we think that these 2 years it's not going to even become a greater problem. So in the years that I've worked closely with young people, I think it has helped me, because I was once young too, and I know when you work with people, especially people probably come from, I want to use the right word, where they come in the communities, they interview young people, and they already almost have a preconceived ideas of the community that they are entering and the outcome they want to get out of those interviews. So how I have worked with the young people, I'll make sure that I listen to them. So I want to share 3 experiences that I think is important to share this afternoon. The first experience is one of the things the young people have shared. They said, Tucci, I feel these health facilities are very youth unfriendly for me. And then obviously you probe and you want to understand what she meant by it. She said that I have made this huge decision of maybe taking charge of my life and going and access contraceptives. But the minute I enter those facilities, I feel like I'm already judged. It is unfriendly because the very same people that are there to help us, they are questioning us of, why are you here? You're only 15 years old. Why are you making these decisions? And remember, she was saying that that was the first. That was confusing for me, because when we do this education, the life skills training, the life orientation at school, we are encouraged to access these facilities. And when I access them, then the whole space that is supposed to be comfortable and safe for me, it's full of judgment. So all the questioning she experienced from the health worker was really embarrassing. And even though obviously she got I don't remember very well injections or pills, she never went back. And remember, this is a girl who's already sexual active. But I think because of all the workshops that we're running in the communities, all the education that she has been receiving at school, And she finally had courage to go and access the contraceptives, but then she was met with judgment. So that was the experiences that I think still now young people are still facing. It's the welcoming the facilities, and it's the questioning that has nothing to do with the health workers. It's basically and not giving those young people and support. And that would be the first experience, one of the stories that the young people have shared with us. And then the second one is like back in 2018, I worked with migrant women, young women. And we obviously hold workshops, and it's an integration process. We want them to feel fully integrated in South Africa. And then the workshops, obviously, we talk about the services that are around South Africa. We discuss citizenship, we discuss what the rights are, and that includes also access. It includes access, accessibility to contraceptives, the services that are in their areas. And remember, mind you, these young women, they're all coming from different parts of Africa. They are attending South African schools. As we know, South African schools, there is education that is taking place. So now they are informed by the teachers that you listen here to, you also have a right to take care of your body, you have a right to make full decision about your own sexuality. You can, in South Africa, you're allowed to go and access contraceptives. And then they go back home, and home is different. I don't want to call it culture, but it's different because they are not from South Africa. How things are done back home is completely different. So you've got this child who's empowered by the South African system, but then going home, she is not being supported by the family. So that's also that conflict that us as facilitators, we need to take care of gently, because these are young people, and these are their families, but also we want to, I think we want to encourage them that making those decisions is really not, it's not really a negative thing to do, but we're also trying to handle it with care. So, but also what she has mentioned, she said that I'm also not sure if my parents they're not encouraging it because they're worried about paper. Because sometimes these young people, their papers is still not sorted out. So that education they get in from school, I don't know if it's miseducation or the education is not enough for them to know that you can still access those facilities. So I felt that it was not a difficult thing to handle, but it was something to think about, that it's so easy for us to come in and facilitate and encourage all that, but also with dealing with such complexity, it's a complex situation, because even though a child is schooled in South Africa, but going back home, she's going back home to her own country, with the country of the family. And the rules are different. So that would be the second one, experience. I felt like, I don't know if we have any answer on that. And we try to involve parents, and we've invited them to be part of the workshops. So they know that we're really not sharing anything that is pushing a child to go and sleep with when they're not ready, but we're just informing so they know that it's there for them when they're ready. And the third one, last year I worked in the Eastern Cape, in the rural parts of Eastern Cape with young women. And one area, Pedi, she knew that, they do classes, and I don't know if she learned that from school, but she knew that it was her time, whether she was ready to become sexually active or she felt like to protect herself if anything happens. She went to to access. And last year it was very difficult because most of the time sometimes the clinics were closed. But when they were open, the health worker said that you need to bring your parent. And she was 16 years old. You need to bring your parent. Because remember the setup, the setting is in a community, everyone knows one another in the rural setup. So, and that, remember she has not shared this with her parents, but she wanted to own her life, and she felt like she's allowed to do so. And the health worker asking her to bring her parent, that was an unfortunate thing, and she actually never went back there. So those are the three experiences I felt like it's important to share, and they happen different times with different groups of young women, but I don't know if there are any challenges. I mean, if we talk about accessibility, yes, they all went. There was access, and maybe not as much as we wanted, but they were met with so much judgment. They were met with that has made them feel not okay. Hence, maybe there's a whole lot of pregnancy increase happening right now.
Okay, so I'm picking up points around questions of questions concerned with even the very frame of citizenship itself in terms of access. So for instance, the point you make about migrant refugee people accessing services, even the fear of being visible to the state. The parents may have a different sense or relation to the state, and one more premised on fear than inclusion. So the logic around facilitations, everyone's included and can access, and yet across the family relation, people's own fears of being visible to the state mean that rather you don't access. that shapes that question, and I think it goes then to the level of policy, which or questions or the assumptions we make at the level of research, at the level of intervention as people are facilitators, but also at the level of policy of who. Even when you say at school, they say everyone is empowered in the same way, but that frame, that horizontal frame, does not mean the same thing. So even the example you give in a community where everybody knows everybody, your so-called autonomy or rights are not the same as it may be in another context. So I'm wondering, Noma, if you have some, kind of your long-term interest. I don't know anyone who's as interested in policy as you are in my personal life, but in terms of what the implications are for this set of questions.
Thank you for that, and thank you, Trudy, for that great introduction in terms of returning to the lived experiences. Because ultimately, whether you're looking at policy, whether you're looking at donor investments, the emphasis is on amplifying the voice and meeting the people where they are. I'm a researcher, Danai. Policy is not really something that I like, but we can't avoid it if we are interested in democratic governance. Just to take a step back, I think my interest is specifically within the category of adolescent youth and young women. And I'm interested in terms of sexual reproductive health rights within the education system as a way of trying to read how the state is responding to sexual and gender-based violence, but also other preventative measures that speak to safety within a particular institution. And here I'm thinking about the school, and here I'm thinking about the Department of Education. So most of my examples and references will be within that frame. But first things first, even the language of SRHR in terms of policy, in terms of governance, it's something quite recent, which is strange in a way if we're looking at our history of women's rights globally that go far back as 1975, in thinking in 1985, in thinking in Beijing 1995, and in thinking again more recently in terms of how do we locate bodily autonomy, how do we think about sexual violence, and how do we think about access to healthcare services. So in terms of practice, in terms of the lived experience, we have been part of these conversations. And again, if you have to look at it within the South African context, I will give you the Women's Charter that I'm interested in my thesis, the first one that we had in 1954. It spoke to these issues. And again, the Women's Charter, the second one that we have in South Africa that came out in 1994, speaks to these issues. But the earliest policy we have is in 2017, the National Adolescent and Youth Health Policy. So we're in 2021, having lost 2 years because of COVID. Truly, what can we say we have achieved, despite the COVID limitations? But let's look at the language that our government is guiding us with. Sexual and reproductive health rights are seen within the services, primarily focusing on contraceptives, HIV testing and pregnancy support, as well as screen and treating injuries and minor ailments and screening of nutrition, mental health and psychosocial well-being and so forth, including violence and sexual assault. It all sounds comprehensive on paper. But what does that look like? And it goes back to what Tuti said. This policy is meant to be articulated through primary healthcare services. And as Tuti has shared with us, the challenge is what we would call within the criminal justice system, secondary victimization, where we have the policy that says a young girl at the age of 12 has the right to safe abortion in terms of services. But here you have an example in Bedi where contraceptives, even though the law allows, are not necessarily accessed. So true to the South African story of governance as we soldier towards the NDP 2030, all these policies are struggling with the issue of implementation, or at the very least, responsiveness. So if we're looking at these, the articulation of these issues within the education system, we have the integrated school health policy that was developed in 2012. We also have certain elements of the comprehensive sexuality education, which speaks to the discourse on sexuality education, but not explicit on sex, and also talks about physical issues. So there's all these other systems that we can talk about. But the moment of COVID also speaks to this tension that Tuti has highlighted between the home and the schooling environment. So let's start with the schooling environment. While we might have school safety committees, we have SGBs, school governing bodies, school management teams, all of them thinking through the National School Safety Framework, the issue of sexual violence that accompanies the protocols, the issue again of peer-to-peer bullying, and all these other things that are on the other side of safety that somehow respond to the integrated school health policy, which is a translation of this National Adolescent and Youth Policy. But who is actually articulating these things at the school level? The very same SGBs. In South Africa this year, we had our 9th round of SGB elections. What we found in some of the research that I'm involved in is that SGBs are not properly trained. And they're only trained in the beginning, at least in the first year of their 4-year cycle, on governance, which is very broad and vague, and on specific policies around language, code of conduct, finance management. So who is implementing these policies at the school level? Let's suspend that limitation of the SGBs. We look at the comprehensive sexuality education. There's also the tension there in terms of the teachers in articulating some of the content and translating it. If you want to extend it to questions of integrating migrant students in terms of xenophobia, homophobia is another way of extending exclusions. And that's just on the margins. It doesn't even speak to SRHR. But again, it speaks to the framing that is meant to be responsive insofar as we're talking about violence, safety, and exclusions. And even within that, as I said, sexuality education, it's still something at work that we're thinking through. But there's also the backlash of the parents who consistently in South Africa have been against the idea of providing condoms in the schools. So there are all these myths specifically that speaks to CSE, the comprehensive sexuality education. One of them is this idea that CSEs will lead to early sexual initiation. And one of them is CSEs deprive children of their innocence. And the last one is this thing that it goes against our cultural religion. So even if the SGBs are progressive, you still have the parents within the system that are pushing back on this. And you still also have to deal with the attitudes of the teachers in finding creative ways to go about it. Now let's leave the classroom and the schooling context and let's go back to our government. Part of, as recent as the 21st of November in Parliament, the discussion was around on how to approach the issue of sexual violence. In the third quarter, there was a report, Stats SA, that noted over 600 pregnancies of young people between the ages of 10 and 24. Of course, there's a whole issue around the details of that data and so forth, but in any case, it does speak to the increase. But what does that tell us about the system within the education system? We know that from the school to the circuit to the district, there's an input of looking at school dropouts and also tracking learner pregnancy. We know that the dropouts, both for boys and girls, those are the categories that are still used, peaks between grade 10 and grade 12. But we know specifically for the young woman that is due to learner pregnancy, unwanted pregnancies. The Department of Education has this information, but what is the response? And so in Parliament, the response in this particular meeting I'm referencing is we're using a multi-sectoral approach. We're working with NGOs and we are training. I think 220 young assistants, teacher assistants have also been trained in thinking through the protocol in terms of sexual abuse and management. The challenge with, in as much as we value stakeholder engagements, multi-sectoral, all these other languages that we use to talk about collaboration, there's something lacking in the coordination of it. There's something about the institutional arrangements, whether you're looking at the budget or whether you're looking at the monitoring and evaluation of things, or whether you're looking at even the quality and the content of the processes, that is not holding. So you have two departments, the Department of Health and the Department of Education, tracking sexual violence, promoting the issue of talking positive sex in the schools. But outside the CSEs, you have NGOs that are funded. And that funding is very fragile and inconsistent, similar to the saga in the SGBs where it's ad hoc. In South Africa, each of our provinces have psychosocial units. I'm not sure how much money they are given, but more to the point, where are they spending most of their resources? When we still don't have social workers in schools, even though policy says we should be able to deploy them because we are that progressive. So for me, the challenge in just addressing more broadly the SRHR within the primary healthcare services and also within the schooling system, it really boils down to the quality. I don't think it's an issue of resources. And yes, attitudes are there, but there are ways to negotiate these things. Part of the attempts by the Department of Health is to create youth zones within the healthcare systems. We know this again from other research that focus on maternal health and child mortality, where thousands and hundreds of dollars were spent in creating playroom and tiny spaces, if you like, for younger children, younger than the age of 8. But all we have to this day are painted walls and dirty toys. But it's ticked in the system that the healthcare facilities hold space and so forth. And so my anxieties, again, with this idea of youth zones under this 2017 policy is that will it be responsive in terms of the needs of the communities? And how do we also find ways to deal with the secondary victimization, if you like, that speaks to nurses being gatekeepers, being patriarchal queens in securing the virginity, in keeping the purity, in snitching on you as a young woman when you have to access these services. So for me, the challenge is really going back to saying who is accountable for these policies. For the National School Safety Framework, again, referencing the November 2021 Parliamentary Committee meeting, the response for the National School Safety Framework, specifically on sexual and gender-based violence in schools, was that it lies with the DDG, the Deputy Director General, who then is in conversation with the provinces. I mean, that response in itself tells you how scattered that is. So we do have data in the system. There is some funding, even though it's international. NGOs have been brought in. SAPS has been brought in. The clinics are being brought in. Young people are being brought in to coordinate these things. But we know, again, in the moment of COVID, that a lot of services have been suspended. And that part of the increased numbers in pregnancies also speak to the time spent away from school, but it also speaks to limited support networks and ways of continuing learning and affirming young people. Because on one end, you want to enforce preventative measures in terms of sexual violence, but it also in terms of building confidence. You also want to talk about positive speak, but somehow it does not translate to it. But later on, I'll come back to an example of an intervention I was part of in Limpopo, a 5-year intervention that looked at sexual violence in schools and how I found that approach more meaningful. But again, the limitation is on sustainability when you have such interventions that are only funded for 3 to 5 years by international donors, and our government, of course, will clap for you and want the beneficiary numbers, and it becomes a tick, but who then continues in the absence of that when we, again, have the systems, have these policies, have people paid in psychosocial services departments, but we're not so sure as to what is it that they're delivering.
Yeah, I think 4 reflections on what both of you have said that maybe connects to aspects of my own work that maybe to throw into the room for our shared conversation. I think in terms of this question of speech, even positive speech or negative speech, I think there's a set of issues around speech and silence itself that is also foundational to some of the key ideas. So, for example, youth as a category and how we understand sex itself. I think that there's also, so I think part of what makes some of them, I hear there's so many multiple levels of speech and non-speech in all of these interventions, whether it's in the everyday, at the level of working with young people, as well as at the level of producing policy. People don't know how to talk about sex, and there's a foundational, for me, I don't know if it's a misunderstanding or if it's an intentional practice of speech. So so youth become a category that is problematic or dangerous for various kinds of reasons. Partly because our understanding of sex is that what we perceive as good sex often gets bound to particular notions of adulthood. I don't know when that, and that adulthood is often tied to particular notions of not only do we think of sex as a particular kind of act that's tied to social and biological reproduction, when it's safest or best, I guess, or most productive, maybe that's the drive to it. So it's most productive when it's within a particular frame of practice that I guess we then, and there may be ways to think about safety, the safety accrued in that context, but it may also be that there's an assumption we make up, because we also know that people having sex in happy socially reproductive spaces are often not very safe anyway. But there's an assumption of that safety that we ascribe to it, and then there's also a way that we think of sex acts as not mature unless they're socially and biologically reproductive. That I think is foundational to some of the language that we assume, even if it's not spoken. I think the other part of it might be that that there's the emphasis on the sex act itself. Our understanding of sexuality then is foundationally stunted in the sense that the sexual relation is the social relation, for me, in at least the way that I've argued it, i.e., every act of engagement, whether it's how we learn to greet one another or pass through space when you learn to move or how you negotiate your body, that all of that is a field of sexual practice. And so all of us are very we're very what's the word? We were very fluent in many languages of the sexual relation, whether it's how we move our eyes, how we move our body, how we shift, how we negotiate a relation into another. That for me is all a field of sexual relation, even if it's not the sex act. So it's not that I'm just in the world and I'm not trying to have sex with someone, but I know I'm in a practice that is within a sexual set of relations. If I'm in the classroom, at the grocery store, walking to work, at work. And so I think that some of the lack of capacity we have across, whether it's at the highest level of policy or research or, just a mother and a child or a nurse, and in conversation where the sex relation is reduced to the potential of a very standard notion, also the physical act of sex, itself. So I can say all this other stuff is pretend, or it's play, or it's because I don't think of it as sex, because what I believe is real sex is confined to a specific notion of an act. That then the room to direct our attention to all social relations as a sexual relation disappears. I also wonder then, because if we're all very fluent in how we socially negotiate ourselves, whether it's in our families or in our work and education spaces, we're all fluent. So there's also, silence is not simply that I don't know, but sometimes strategically it's useful. I don't need you to know what I'm doing, or I may know that what I'm doing means this, but it also could mean this and this and this and this, because it allows me to, so I may want to have a child, because not just because I couldn't access a service, but it may mean something else about other aspects of my social interactions or relations to the world. And so even while it makes me problematic, that too is a choice related to autonomy, so even our notions of freedom themselves may require something to be, and I enjoy that you went to let's think about these moments around which we've conceived of freedom and put it into language, because they speak to people trying to struggle towards, what does it actually look like? What does it actually feel like? And then what are the things we can put in place to make it more possible? But I wonder the extent to which those notions of freedom, because we've had such poor attention to, and often when sex is approached as a problem in the first place, that questions so that how desire operates as a broad affective field in the world, it controls everything. You can't turn your TV on, drive your car, walk somewhere. It activates all aspects of our being. You go to work to get a paycheck for a reason, right? And I'm not meaning the sex act itself, but a social and economic and political field of practice. And so I wonder to the levels at which, because our attention is on the act and then on this category of youth, and that I wonder the extent to which all interventions are not because I don't know if it's failing. I mean, maybe there's an inherent failure because we both have the language and the fluency because we all live in the world. It's not like we don't live in the world. But I guess the ways that we probe our questions are so deeply contaminated with this attention on problematic categories of persons, and then an intervention around which we assume a logic of freedom that we have barely questioned itself. And then all the other stuff that leaks across those, strategies people use, ways of understanding. Someone simply saying, I just want someone to love me. What is the point of life if nobody loves you? I'm sure life has a point. But I'm saying, for me, that doesn't mean nothing. It means something that is meaningful to all of us. And yet it slips out of the radar.
You're touching on a lot of things. It's quite exciting. Desire, sexuality. But one of the things that I think that's quite key for me is in framing sexuality as social relations. And I think that's a very useful way of thinking through, because that's precisely where we run short in terms of our interventions. So let me tell one story as part of the sexual violence in South Africa that I was part of in Limpopo. So we started the girls' clubs, focusing on grade 8 and grade 10. The attempt was to try and move through this cohort and see and track the learner pregnancy and see if this intervention somehow would assist in ensuring that there's a decrease, because we know it peaks at grade 10. And so we're not interested necessarily in rape and sexual violence, but we're interested in unwanted pregnancies. But we also, of course, came to understand that there's the horizontal sex, not as an act. Okay, that sounds wrong.
Let me try again. There's the peer-to-peer sexual activities amongst the learners under the age of 16 that speaks to the idea of desire and expression and also them, finding their bodies and making sense of it. Whether they have the capacity psychologically to hold themselves through those and the trauma that comes with sex, we don't have data on that. We can only assume and rely on the psychologists for that. But we also found a number of cases where young teachers are taking advantage of the learners. One particular case that was interesting, 22-year-old teacher, new to the school, impregnated about 4 learners. And when the issue was sent to the SGBs, of course I can't reveal the name of the school, when the issue was sent to the SGBs, it became an issue of parents fighting over maintenance. To take a step back, in some of the working class and poor communities, the school is a site of development. So there's contestation around the teacher posts, who gets the tenders for nutrition, scholar transport, and so forth. So even the teacher now becomes the resource in that instance, where it wasn't an issue that this was a minor who was under 16, that this is actually statutory rape, but it was a question of who the teacher will choose to wed and keep. And so if you look at the statistics, okay, let me finish that one thought. How that issue was resolved in one family, they just wanted some payment, a goat, to acknowledge the wrongdoing, and that was culturally acceptable. And so you would call that community engagement. At least that's what it was sold, that the issue was negotiated. But nowhere does that center the child. So whether you're looking at it through cultural perspective or through human rights, at the core of it, you're talking about the best interest of the child. And in some of these cases, this does not come out at all. There's also the issue of learners impregnated. Another case, also in Toyandoli Bombo, different school. The learners were caught kissing, making out in the back of the room, so this was destabilizing. There was a meeting, parents were called in. Both parents were very much okay with that because the young woman had moved into the backyard to this young boy's family because she was pregnant, and they thought they were doing the right thing to ensure that she returns to school. Lena pregnancy policy tick. She did not drop out. But how that was resolved is also problematic in itself. We're in a country where, in terms of our cultures, to loosely use that, we don't have child marriages, unlike maybe in Mali and South Sudan in terms of Muslim arrangements that are tied to cultural and religious issues. But if you're looking at our Lena pregnancies and these community interventions, if you like, it's as if we are operating in a context of child marriages. The ANC government, of course, will praise itself, and yes, it's true, there are shifts. There's a report that they conducted in the DBE in 2009, and they claim that there were shifts in terms of accessing sexual reproductive health rights from the 1990s to date. That is true. But what does the data tell us in 2021, the first quarter, is that first things first, the sexual debut is dropping both for the boys and the girls. If I'm not mistaken, last I checked in 2019, it was at the age of 10 and 11. Never mind what is actually the question we put to determine that sexual debut. That's a conversation for another day on research and the politics of language. But when we look at the data, in 2017 first quarter, must be between the ages of 15 and 29. In 2017, the entire year, they reported 84,669. And this is the national deliveries only in the ages 15 to 19. Only in the first quarter of 2021, that was 35,209. The first quarter only. Same thing for 10 to 14. If you're looking at 2017, the number there overall was 9,327. Again, 2021, first quarter, we were at 3,228. So what tells you is, yes, we have rights, yes, we have language, yes, we have the activities, yes, the sexual debut is dropping, and we have higher numbers globally. I think we're 35% more than the average globally of unwanted teenage pregnancies. And in each quarter, we seem to be doubling and tripling all of these numbers. So again, is it a question of freedom?
Like with my 12-year-old running around who I would die if she was like, I'm having sex now. No, I mean, but this is, I guess, part of what I'm. So, I mean, I think I'm in more and more conversations with friends and colleagues who work in sexuality studies. More and more of us are talking about, in particular, and I think there's a broader question, maybe not freedom, but maybe a healing justice that needs to come into our conversations about things that are different. So if many of our debut experiences of sex, and also something that I don't know if we have enough space and time to discuss this. A lot of young boys have their first experiences of sex with older women, but there's no language to actually describe what it means and the repercussions it has for ongoing relations of sex between women and men, men and men, and vice. So that there's something about that question of there seems to be for me something connected to the broader question of violence. And what can and cannot be spoken in terms of gendered relations of power that operate between relations between men and between women, and also that is connected to that question of sexual debut, or how people come to know what it means to have sex, that I think where we need to retain a conversation around autonomy. So the question of autonomy, that I think is important to hold on to, because there's so many areas that we don't even know in terms of our own interest in the work we do and what we're interested in that's connected to our experiences that are difficult even to name. And so I think there's a broader question around healing justice. I don't think we can correct simply with because a lot of the ways that we construct the problem is then we can make axes of a lack of exclusion to the position of where a person's debut comes in, that I don't know if enough of us working in this field are dealing with that there's a deep structural healing problem around how we understand sex to begin with, that is rooted in that question of sexual debut, and that I think, and at the same time I want to hold on to this question of the customary. I know the customary gets a lot of potential flack because of how we understand tradition itself and culture, but there are many. So if it's possible in one context for there to be 10 understandings of the law itself besides the formal law, and everybody understands that, even the child you're describing who's like, I'm living with my boyfriend. Okay. So there's many operations of the customary there, and I don't just mean the customary as it's codified within like chieftaincy and and a kind of consolidation of patriarchal traditional power, but the customary as in teenage people may have their own customary forms, things that they let us in and out of depending on our interests, and there's many operations of that goat being, when the goat comes to compensate for that moment, is it a particular moment of recognition of a wrong? There's many things along the side of, okay, this person is resourceful also in relation to the economic, which is also for me a form of the customary. So I guess along with saying what ways could we have to structure a broader, there's a structural healing around sex across the board, because I also don't know if I believe that adult people are having not violent, are not caught in the same strains of, there's so many roots that happen at that point of debut of sex that are rooted in violence, that most people are actually just having violent sex. I'm just going to go out and say that. And so that's a broader structural thing, that there's a broader problem of sex itself. But young people become a particular kind of category because they shock us and we want to also protect our children, because we don't know how to protect ourselves.
When you mentioned that we understand the language, who is we understanding the language, and how does it speak to?
So there's many languages. So I guess we code switch, right?
Okay.
So you can be in a situation where you can work as an expert and a facilitator, and you know the language of the law and the policy, and you speak it expertly. And then someone says to you, I'm coming with a goat, and you also speak that language, even though you're like, it contradicts the other language I speak. And then there's someone brings another language, and you also speak that. So and those for me are not only different codes of language, but they're also for me what I would call different customary laws, operating the same field of practice. The one we prioritize is often the one we think of as the most so-called progressive. But they're all operating the same field of practice depending on our position in the space.
I hear you, Danai. I hear you. And I'm not disagreeing or anything. And again, I mean, we have to move to the other section of the conversation. But I also want to share just one story, again, looking at this intervention of the girls' clubs and having these sessions around where we use the language of bodily autonomy, and now it had to be translated in facilitation to say, how do you begin to bring these indicators that we're tracking through programs in that school level, speaking to 13 to 16-year-olds. What was useful for us was body mapping. So more broadly, looking at the idea of vulnerable sites or where safety might be compromised. So mapping the entire community, whether you're walking from home to the school, whether you're passing, open fields, whether you are susceptible to taxi drivers and all these sorts of things. And we know this even for people outside the school. What happens when you're just walking down the street, the sense of entitlement that men can have on your body and so forth. But what was particularly hard, and we had to bring in experts, was when we were done with the safety mapping of the school where the stabbing, physical violence happens, and the beatings and the violence in the toilets, which is, being hit on the bum without your consent. I think it's sexy if it's in the kitchen with your partner, but it's something else if it's unwanted in a public space by a stranger, also even someone that you know. But one of the things that we realized that it was particularly hard to shift from that safety mapping exercise to the body. And this is where a lot of these traumatic experiences emerged. So, okay, we see where the safety issues are within the context. And this is where we found the stories then of unwanted touching, sexual assault, and violence. And even when we found the group of the young mothers, and we're saying, let's track the others that have dropped out previously, and we found that it was unconsented sex, but they did not want to use the language of rape, whether it was a peer, whether it was a teacher. So there is a challenge in translating and trying to articulate those violations that still requires much work. I mean, there's a lot of NGOs that are doing this work. I'm not saying it's new, but just to appreciate your point in terms of translating some of these things that we're trying to track through indicators and research and policy, but how do we actually find ways to foreground the voice? And I think artistic expressions like that are quite useful in trying to surface those experiences in ways that can easily be communicated. And so what we did in the intervention, we shared all of those body maps, but of course we had to swap them around so not each person tells their story at the school assembly as a way of actually also conscientizing the entire school and presented also to the SGB. And part of that also spoke to identifying the gaps within the code of conduct and identifying a teacher within the school who would be a confidant and not just the life orientation, but a teacher that you would go to. But I mean, these are very small scale interventions, but in terms of holding space, in terms of being responsive, I think they are quite useful. And for that, I would say the government needs to channel more funding to NGOs for that work, but the government also needs to deploy its own human resources in terms of tracking that. So even if you're changing the service providers, there's continuity of the work. And yes, I hear your point in terms of also the sexual debut of boys and so forth. And yes, I'm feminist and all that, but also when we look at the statistics, HIV prevalence amongst girls is 4 times higher than boys. And again, this also speaks to sexual violence. But I take your point, Danai, that we need to look at migrant communities. We need to look at your LGBTI community when we're thinking about sexuality, and we also need to look into the boys. But our policy approach has always been that of responding to the ugly rather than anticipating the good and creating a conducive, healthy environment. So I think there's also that balance that we need to think through in our interventions. Thank you.
Thank you, ladies. Thank you so much. Would you like some closing remarks before we share some questions, or we can do that after the questions? All right, we've got quite a few questions that we have got it online, but thank you so much for that discussion. At some point, at that silence, we were all trying to absorb. We were all trying to absorb, the reality of it. And what came across, if I can abuse my power a bit as a host, is this is not shocking for people who've been working in this space. And thank you so much for quoting the statistics as well. I think part of what really got to many of us was the public's response the way it was phrased in the media as well. We had people victimizing these young adolescent women. We had people having a very myopic understanding of the realities that exist. So thank you for not only defending these young girls and giving us an idea about the rape cases in schools, which were meant to be safe spaces, and in homes as well, and the politics that go with it. But also thank you for giving us the reality by talking about, sexual debuts being in some parts a consensual experience for some, and how it's very difficult, as you know, with researchers to actually engage with younger people in terms of research, but with psychologists we're able to get at least that secondary part of information. So thank you so much, and we've got very exciting questions at the moment. Can we please start with the room? If I'm not mistaken, we've got a question. All right, my bad. We're actually going to start with the online questions, and Hulisani is going to help us with that.
Hi everyone. I just want to start online just so that we can get the participants who are online into this space. So we're going to start, there's quite a few questions, but I'll just start with one. We have a question here that asks, how do we draw the line between encouraging and right to SRHR services or products when talking to young people? How do we draw the line between encouraging and then I think maybe they want to ask exactly encouraging them and just actually educating them, because they think there's a fine line between the two that people want to make a distinction between. Then after that, the next question here asks, how do we break communication barriers between rural and urban areas when it comes to SRHR issues? It seems like their understanding of SRHR or sex is not the same. Hence, there's a lot of issues of accepting in most rural areas. I'm not sure if I should continue with the questions if you're noting them down, or if I should...
One more.
One more. Okay, let me just go to the next one. This is more of a comment. There was a comment here from Rose that says there is a lot of resistance, especially from the older generation. They think that sex talk or embracing sexuality means that you're encouraging people to have sex. Even here in Zambia, comprehensive sexual education is being shut down left, right, and center. However, the rate of teenage pregnancy is astounding. That was just a comment. I think, let's go with those two, and then we'll come back after we've gotten the room.
All right, 3. Would you like to split the questions? Is anyone dying to answer a specific one?
Let me start with the first one, and I think it will also respond to the third one.
Okay, thank you.
And then I'll hand over to my colleagues, and then I'll come back on the rural-urban divide, just to think out loud. Thank you so much for those questions. Drawing the line between encouraging and the other side of that, I think it's a question of young adolescent people are having sex. How do you talk about it? And so part of it, and I hope this won't be offensive to the person who asked the question, but part of it, it's that myth that talking about these things speaks to encouraging and therefore promoting this idea that you can have sex, or the presence of condoms in schools, like I said earlier on, speaks to that you can encourage. But there's evidence. Of course not in South Africa. We don't have the studies just yet. If they're there, they're fine few in between. I'm not familiar with them. But in terms of the international literature, we know that what has been traced in some of the countries is that the exposure to CSI actually leads to responsible behavior, in a sense that there's more thinking with sustained interventions as to I am ready to have sex at the age of 13, and whether to consider if I would like to have a condom or not. Of course, there are other structural barriers that speaks to whether I have a condom or not, and issues that speak to confidence raising. But going back again to the example that I gave earlier on in the girls' clubs, part of it was to encourage that sense of confidence. Know your body, masturbate before you can even offer your body to somebody else. Don't shy away from the conversations of masturbation. There's a study that was conducted, I always reference this, I forget the year, apologies for that, but it was on HIV and AIDS in KZN, where they asked women who were over the age of 45 years whether they've ever experienced an orgasm. And this was translated in sounds and in different categories in Zulu. And these women felt they had never experience an orgasm, even though they had given birth so many times. So what does that tell us then about understanding our bodies from a very young age? So my response to the first question is, it's not so much about drawing the line, more than it is about packaging the information and giving the young person the tools that when you menstruate, you're not meant to feel ugly, or that you are dirty, or that when your breasts are bigger and they're starting to show and your body's developing, you can no longer play skipping rope. There are sports bras, man, go back, play, it's your right to play. But it's about packaging this information to say, you are empowering in a sense of saying, the world has all these possibilities. It is your body, but you also have to be responsible for the choices that you're taking, that unwanted pregnancies are a result of not using condoms and thinking through these things. And at times for parents it's difficult, but I think it's the responsibility of the education system. But like I said, similar to the speaker, the person who posed the question from Zambia, that there's a backlash from parents. And I think this is where the state needs to be better and lead the communities to say, as part of the education, there has to be an assistance, because we know that education offers protective, at least functions insofar as providing this education, even though as Tuti highlighted that that learning might be a little bit difficult if the family household environment is conservative, or rather teaches you quite the contrary. But let's encourage young people to own orgasms and masturbation much later in life, so that they know not to consent to things that they're not ready for, that they don't even understand. And we live in an information age where if you're a parent or you're a teacher, you're uncomfortable with these things, there are manuals, there are YouTube videos that you could try and translate. So yes, let's encourage young people to own their bodies and yes, fetch their orgasms responsibly.
Yeah. Are you done? I think to answer the question as a facilitator, someone who's worked in an NGO setup and working with young people in different communities, I don't think we're really encouraging anything. We know for the fact that kids are having sex. They are engaging. But also when people say you're encouraging it, I'm a bit concerned, because now we think that sex or health education, discussing what is happening with their bodies is ugly or is bad. I think we are trained to know the type of information that we share with particular age groups. And yes, I like what you said, the packaging is very important. But also the language. Hence I was asking that you know the language, but also it's people who are in communities. We need to be able to translate that language to our young people. So when they attend these workshops, these trainings, they leave them feeling empowered, and also, who knows, maybe they are able to have those conversations with their parents. So I think also it's time that I think sex is beautiful, yeah? And especially a 15-year-old, a 16-year-old, their bodies are changing. I was telling Danai's cousin earlier on, I've got a son, he's 12 years old. And I had to talk about masturbation because he's always closing his door a lot, you know? It's like, what is happening, Ulutu? Sorry, Ulutu. What is happening? And I'm concerned, but I also don't want to be my mom, because I remember I told Danai knows the story. When I was 15, I had this beautiful love relationship with this boy. But you know, when you're in love when you're 15, it's really not even about sex. But I think the sex education empowers you when you're ready and you know where to go. And I remember, obviously, when you're in love, I come back home, and then I come back home 11 o'clock in the evening. My mom discussed nothing with me. She took me straight to the gynecologist. And that was a trauma for me for years until I met you. And sometimes the trauma, we forget about it. And I think it's important that, because my mom was maybe a bit scared that I would have a baby, or she saw sex differently, I don't know. But I don't think we're not encouraging anything. We're basically saying, yes, it's happening, and how could we support and assist you? And with my work, we even encourage parents to be part, because we knew we're all coming from different backgrounds, and we wanted them to hear what sort of information is being shared to the young people. Yeah, I think.
Yeah. If I do a short reflection, for me, and it always goes back to why do I do what I do, and in terms of why. So, for example, why consent matters for me and why it matters, for example, to teach it to my child. So much of what we are raised with as children is precisely that. So even a small thing to say, can I have a sweet, and you don't know how to say no, thank you. It's not even before you get to the sex act itself, and that's why I go to the social field of practice. So much of how we are, and so with my child, before we get talking about, well, what do you do with sex? I'm like, if I don't empower you to say, what are your own boundaries? And to say your own boundaries isn't just to say I trample over other people. It means, how do I relate to others in a way where I can be safe and you can be safe? And I think we're coming from generations of our, think about it, when my grandmother would say things to me that made me feel ashamed of myself and my body. I don't think it was a cultural practice that is conservative. It was the language she had to try to keep herself safe. So hide your body and be ashamed of it, and maybe you can stay a child, because in my experience, the minute I wasn't a child anymore, I was now available to things I could not consent to. So at least childhood gave me a space of safety. But the way she expresses it, then I accumulate a shame that then I inherit on my body, as opposed to where. I think for me, it's how do we think about forms of language for each other. So let's say, if I'm teaching if she's like, oh, do you want to hang out with this person, or for conversation with my child, like, used to make play dates for your child, then she says, actually, please don't decide for me who's my friend. Let's start there. I want to choose my own friends. I know you like a mother, but I want to choose my own friends, right? So that's a small conversation, but the lesson there is one that I'm an adult still learning. Because we're not coming from contexts where maybe a way to express that level of boundaries has not been expressed just in general social relations before one gets to the act of sex itself. So I think that there are other kinds of conversations that we also need to premise before we get to now who comes inside your body or who touches your body in certain kinds of ways. And so I think. So I think we should be more worried about that. I also think just one thing, and I see you, I was watching a reality TV show with my child about a marriage practice, and the language itself looked very conservative, like, oh, you're learning sex, you're going to live with your husband the first time, like sexual innocence is pure. But you see how people are, but there are other forms and spaces in cultural practice that do inform people about orgasms. Yeah. And they're not spoken maybe in the ways that we think are authoritative, but whether it's dance movements or other social relations, kitchen tea parties, there are these other spaces that we undermine because we've allowed ourselves to believe that in this rural-urban separation that makes some things more progressive and less progressive, but there are spaces of freedom also in these other locations that we take for granted. So what we say sometimes doesn't mirror what we do, because there are other spaces of articulation.
Thank you so much. We've actually got quite a few questions on the online platform, and we're very grateful. And before we read those, we actually have a question in the room as well. We've got Kumal, who is a previous speaker, who'd like to have a question. May I ask that you target it to a specific speaker, because we've got other questions that I'd like to pose to each of you from the online platform. Thank you.
Thank you, Madam Program Director. I've got a question for Danai, and I've got a question for my good colleague, Noma. Two separate questions. The first one is around this idea of violent sex. If we take it a step further, right, and move into notions and conceptions of sexual liberation and freedom, how do we understand the idea of violent sex vis-a-vis BDSM and fetishism? That's the first question. Second question, Noma. I'm curious about, and I like the concept that Danai actually gave us, which is the idea of different languages. I'm curious as to how And when these different languages, which can sometimes have cultural contradictions, intersect, how that intersectionality can either be a generative space of reconceptualizing culture, specifically in the space of sexuality as it's playing itself out in individuals that we are considering as minors, right? Are they allowing us to rethink, or do we fall back into the categories that we already know, which I saw you doing earlier, which is the category of child marriage, or the discourse of child marriage, right? In the sense of thinking about the fact that we don't practice child marriage in the South African context. And I wonder whether, is it really a discussion around child marriages, or is it a discussion of the 21st century facilitating such radical and rapid change? I wonder if that's making sense, right? So does this new sexual liberation of minors facilitate a cultural transcendence when you have these linguistic contradictions, if one can call them that? Thank you, colleagues, and a lovely, lovely panel, by the way.
Thank you so much. Can I please compound these questions, because they're very much related to some of them online. So you asked Danai about violent sex. I just also wanted to share a comment by one of our delegates online who said something about healing. And they said that also, without triggering people to a point of spiraling, some people aren't aware of how little self-awareness they have about sex. You'll find often that that people have sex because it's expected of them and not because they want to have sex with that specific person. People also try to hype people into becoming a couple, so they feel pressure to have sex even though they don't necessarily want to, but would rather give it up now instead of having to use words that allude to rape. So that was just a comment in light of, I guess, sexual violence, but not so much BDSM. And then Noma, Kumalo was asking about languages. We also had a question about cultural intersections. We had one of our speakers, Asanda, or rather one of our delegates, he was asking, is it really wrong for the older generation to have the sense of resistance that is connected to their value system and a way of doing things? So he says, looking at the Zulu culture that puts high value to virginity of young women and celebrates them for it, is their resistance to embracing the act of sex among the youth really unjust or wrong? So that would be for Unoma. And then Tuti, if you're comfortable commenting on this, or you can relate to someone else. We also had one of our delegates, Neville. He was saying, culturally speaking, we would say that the idea of offering a goat to be called damages. Do you think that it contributes to the dark light that is shed towards sex and child pregnancy, or does it show an understanding of it and bringing it into spaces like a school negotiation for what a teacher needs to pay for in the context of raping for young women? So I know that Noma had brought it up, but if you're able to comment. Tuti, who would like to go first?
Maybe you can expand on that, because when you've mentioned that a teacher who's had sex with a minor, and now they slaughter the goat. I think that act was violent itself. I haven't had any experiences with young people who have obviously been exposed to that, but it is something that is sitting uncomfortably with me. I think the adult took an advantage, and now the adults are making decisions without even bringing in the person who has been obviously violated. And the goats and the culture, I don't know if it's really culture. I don't know if it's, yes, you mentioned that there is community engagement, but I don't know if then the healing takes place. I think it's even more trauma to a child. And instead of really concentrating on the healing of the child, because obviously she was violated, you can still enjoy sex, but you still feel violated if an adult and a child they're engaging. So I'm completely against I know it is sometimes cultural practice in other communities, but my question is, what happens to the minor As adults, we make all these decisions. We say it's our practice. We've been doing this for years. But what is happening with this minor now who's going to be raising a kid, who's a kid herself? So I think that's how, that's where I'm at with that.
If I may come in there, I agree with you fully, Tuti. But it's not sex in that instance, right? That's statutory rape. It's a violation.
Yeah.
But what I was trying to highlight is this idea of the process is ticked. The parents were called in, the S2Bs, the principal. So the issue was engaged. And so it's looking again in terms of what are then some of the practices in dealing with these issues. I'll give a parallel example and then I'll move to the other question where in one of these schools again, the teachers refused to teach pregnant learners, especially those who were already showing. A, it was seen as shameful in terms of the school uniform. B, the teachers themselves felt that they are not social workers. And the excuse was, what if there's a health-related emergency? And so that was part of the stigma. So instead, the S2B requested the parents to send someone. Either you come yourself as a mother, and of course this is delegated to women in the family. Either you bring in the mother, or you pay Danai to sit at the gate while your pregnant learner is in class and walk back so that if there's anything related to their health, the teacher then says, Danai, there's Noma there going through these things. So I was trying to highlight the practices, not so much to say that's the way to go about it, but it's this logic of saying meeting people where they are. And culture, of course, is used a lot as a blanket statement. But if we were to go to the logic and even this problematic language of damages, that in itself is problematic. Because if you're counting the rupture of the hymen, you're not counting for the orgasm and not accounting for it, and the consent. But you are here honoring Nkomo Baba by paying back this cow and this goat. So that's another conversation on the cultural scripts. But I was just trying to highlight there how culture is also used to couch opportunism, truly, from the parent's perspective, in trying to source something else, but also in trying to deal with this sense of shame of this sexually active child who's no longer a virgin or who's now ruined because they are pregnant. Just to highlight that a bit. But of course, like I said, we need to meet people where they are. Kumalo, thank you for that question. It was quite dense, but I'll try. I'll try in the language of cultural differences and imagining intersectional approaches. And here I'll lean on Danai's earlier intervention to say, sometimes people like me focus so much on policy and what the state is doing, and that we forget or overlook initiation schools and other practices. So we know, for example, in some of the cultural practices for young girls and women, that there's part of teaching on how you come to your body and understand it. Yes, we might come to critique it, that it's heterosexist and so forth, but there could be ways in which we also not import the human rights language, but encourage speaking from a space of confidence, whether through the dancing or through understanding the beats or through the dance codes and all these other things. So I think there's hope in thinking through outside and with the state, and there's hope in honoring some of these spaces that are deemed as somewhat cultural. But as the child of the 1980s, I can speak from an experience also that comes from the state, but is very much community-centered. When Love Life was Love Life, and when the sports and culture was funding Love Life consistently, you talked about menstruation, you talked about sexual violence, you talked about condoms through play, working with trained practitioners, creating those scripts, sourcing them from the young people themselves, using their languages, and traveling with that. We also have NGOs that use the boys and girls clubs that could also be seen as a space of bringing together the different clubs nationally to say, if in Limpopo these are the cultural practices, what do they look like in Bedi, and what do they look like in the Northern Cape and Free State? And that could be another way of really understanding some of these interventions, more than from a cultural perspective, but from below, and meeting people where they are. Thanks, Kumar.
So I think that I know you did not want us to do this, but I'm wasting time by apologizing. There's several contexts around which this question of the goat, or comes up, and so I think there's also a question of legitimacy that needs to feed into it. So a simple thing like my boyfriend won't put me up on his WhatsApp profile picture, and then he's like, but the family came and showed up with the goat. There's that questions of legitimacy, or to marry. The number of people who are like, well, they came to marry me to own up to this thing, but it's also that I don't think it's simply the absence of the child, and in fact, most of these ritual practices is an assumed absence or lack of voice of the person being engaged. But I don't know if that's necessarily always true, because people will talk in different popular discourses about, well, no uncle ever showed up, and that could mean just as much as being put on the profile picture or being asked to be my girlfriend or married, in terms of what it means in terms of other aspects of the social relations. I don't know if we say there's no voice to it, but there's also so many adults I know, people who are my peers, who whether the person they got married after they were pregnant as a young person, or the process where they now realize that they've had 30 years of experience of sex that was rooted in ongoing lack of consent and an ongoing misunderstanding of sex itself. So the goat only becomes one point that amplifies that all the sex has been pretty terrible. Not just terrible because there was no orgasms, but it's been foundationally violent. But they found that it's this years of experience of that is like, why am I so depressed? Why am I so unhappy? Even though I have all the things I want structurally. And it's because, so I think there's many things operating. And this question of sexual violence, in some of the most violent sex is the most vanilla. You're just lying. I once heard a colleague at a conference talking about, that time when you're on top of a woman and she's frozen under you, so you have to finish quickly. And he was telling me like it's a normal conversation, just over dinner and drinks. And that's some of the most, so I think, and people understand that when I talk about the body, maybe we have a stiff body. That's something that we somehow, again, we may know. And so so that to me is, so much, we're so far away from ourselves. Most people don't even live in their own body. By the time you realize how much of your own sexual experience is violent because you've been so absent, people normalize, I was doing groceries, haha. If you're doing groceries during sex, there's something wrong with what's going on, but that's a lot of people's experiences. And so for me, what I say violence, if I'm in a position where I'm owning my body, and when I say owning, I don't mean the capitalist sense, as in I'm engaging, I'm enough in my body that I know what I'm experiencing. My spirit is engaged, my soul, everything is connected, and I'm in a relation with another person that's intentional. I'm very happy to be choked. I'm very happy to submit. Right, because I'm in a relation, but I would be very certain to guarantee most people are not in their own body just by themselves, even when they're masturbating.
Thank you so much. Just to wrap up, we've got two last questions from our live audience, or rather our live team, because there are no visitors. The first one is from Osbel.
Okay, hey everyone. Mine is rather a comment. It was a question in the beginning, but since it was raised, it was, brought into the floor. Now it's a comment. The issue of encouraging and education, it is indeed a challenge. It's a challenge in a sense that when you approach a school, and you explain to them that there's this thing that you are bringing, that you need to work with learners. The teachers somehow feel threatened. The teachers somehow feel like you are encouraging these learners to have sex. When you tell them that it has to do with sex. We are bringing sexuality education within the school. So I am very much happy that the speakers, more especially Noma, you brought up an issue of, the way you approach, the way you address, and the way you facilitate the session is very important. Because you need to approach it in a manner that is edutainment, not in a classroom manner, so that it can be received good by the learners, and the teachers can also understand that it's different from, the formal way that they do things in class. So hence I'm saying that it's no longer a question, it's a comment. So I just needed to emphasize on that and add on that. It also has to do with, how much training did the teachers receive to address and to facilitate such a context to high school learners, or to learners for that matter. So yeah, it is very important to find a way to differentiate between encouraging and educating, so that the person that receives this information can be able to understand. Thank you.
Thank you so much, Osbelinda. And I think it's really important to get that perspective, because Osbelinda really works with schools at the Center for Sexualities, AIDS and Gender. We've also got, I will abuse my power a bit, because this was a topic we anticipated would have quite a few comments. We have one from, I'm not sure if you can stop me, question from Boipilo, and the next one from Turuna, and then we'll have up in terms of time. What's going on? Thank you.
Hi everyone. I feel that education about such matters should not just only be in schools. It should also be extended to communities, to households. As an older sister to quite a number of girls, I'd have conversations with them and they'd actually explain that, okay, so this happened and this is how I felt. When we were talking about girls feeling ashamed when they're on their periods, them feeling embarrassed about their bodies, and let's say this person got raped and they were raped when they were on their period. So now they're afraid to tell their guardian or someone else it is that they trust about the event, and they get stuck. They get stuck in the situation. They don't know who to talk to. They don't know what to do. Do we encourage them to face that trauma? How do we encourage them? What should they do? Who should they talk to? That is my important question.
Thank you very much. And the last question for today, whether we're going to have or comment, is from also be joining us tomorrow as a speaker. Thank you so much, Turuna.
Okay. I actually have quite a long comment, because I found this panel quite fascinating, because I think there were a lot of contrasting views shared on how to approach adolescent sexuality. So I think I'm going to start off by saying that I think that many of the responses are shaped by the state actually acting as a patriarch in this situation and prescribing as to what they envision how teenage sexuality should be played out between people under the age of 18. And I think that from my perspective, the question of how public morality shapes law becomes very important in policy development and implementation, because when you consider the challenges that young girls and women face in accessing SRHR, they're not that different in the sense of the challenges broadly are the same, but the way you interact with the healthcare provider differs depending on your age, or how they perceive you should be acting based on your placement within society. And And I think that in Noma's presentation, we really understood that implementation and effective implementation is really the challenge, because it's not that there is a lack of expertise, skills, and ideas around initiatives that can be implemented to combat these issues. But I think that one of the big problems is that the state often essentializes what these challenges are that young women are facing in their relationships, in their sexual interactions. And I think a big problem with the way SRHR programs are developed and implemented is that they lack the approach of incorporating a healthy development support structure. So when you think of sex, like Danai was saying, you shouldn't be thinking of sex just as penetration. Have I been penetrated by a boy? It's the entire sexual relationship and the way you mentally and emotionally engage with the concept of sex in your life. You're supposed to be developing at that age in that way. You're supposed to have healthy sexual development, understanding what sex is, understanding what consent is, engaging with different forms of sexual practices. So I think this kind of heteronormative approach to human sexuality is stunting the implementation of SRHR programs. But beyond that, when it comes to encouraging or not encouraging sex, I think you should be encouraging sex, because your behaviors as a teenager shapes your behaviors as an adult who's engaging in sexual relationships. And I think a lot of people only have that real sexual awakening much later in life because they haven't been equipped to explore these alternative forms of sexual lifestyles, whether it's polyamory or getting into kink or whatever specific form of fetish or interest you may have sexually, because there aren't healthy ways in which you can introduce these things into your life. It will often come in the form of a sexual predator preying on an underage person who exhibits an interest through, it used to be chat rooms, then Facebook and Mixit, and now it's Instagram and Twitter and TikTok, and I don't even know what else. I think I'm kind of getting old, but I really do wonder. And then secondly, I just wanted to hear your thoughts, if anyone is willing to share, about when it comes to people with specific vulnerabilities in society. So people who are differently abled, people who are less visible. So let's say in South Africa, if you're not speaking a South African language or English, so like a migrant person or a refugee living here, as well as people who engage with other sexual, like same-sex attractions and stuff. Like as a young person, you may not have the language or the labels to put on yourself, but you start to engage in sexual behaviors. And how can this support structure also make visible these persons and these sexual practices and behaviors while still ensuring that the individual still has access to SRHR in a manner that doesn't discriminate against whatever their identity may evolve into, or make them take on a label that they are not ready to accept yet, but that's the only way that the system will recognize their sexual practices. Yeah, that's it.
I might be a terrible person for this, but Taruna started leaning towards heteronormativity, about social change and about disabilities. And to be quite honest, that's quite a discussion that we're going to get a lot into tomorrow. And if possible, we will be continuing the conversation offline as well. And I would like us to please wrap up, if that's cool. Just final words from our speakers who might not be joining in person today, or tomorrow rather. And then we will be closing off today. Thank you. Final words. 1 minute, please.
1 minute. It's all exciting. Okay. Thank you so much for the conversation. And just to say, there's someone online who talked about virginity and culture and so forth. And I think, again, it boils down to this idea of where do we place the black body, the young person, where they are. So if they want to preserve all their identities rooted in their Zuliness, I think that should be encouraged. But there's also transgressions that happen, violations in there, where they're not consenting to it and something it's imposed on them. And again, we live in this patriarchal culture where sex sells. It's everywhere. It's in the songs, it's in the food, it's in the adverts. And so it's very difficult to actually avoid it. So thank you so much, Sis Belinda, for emphasizing that. But the other side of also teaching sexual education is also focusing on boys. There's one study from the Medical Research Council, I forget the apologies again, where young boys, young men were interviewed between the ages of 10 and also 25. And one of the key things that made me remember this was this idea of group sex and the type of sex they had with women. And there was a response where they all scored high, where they do not look at the person they were interacting with. So that sense of disconnecting your body and being detached from this person in pursuit of your very self-centered, individualized sex. So I think that's another way of looking also of sexuality, not just so much focusing on sexual violence in terms of the woman's side and perspective. And of course, Sissy, you talked about the conversation around dealing with trauma and shame in terms of the body. Luckily, we have a lot of hotlines, from your GBV national hotline to Lifeline and so forth. Also, as a big sister, you can reach out to those institutions and say, these are some of the things that are happening. what kind of psychosocial support that can be facilitated. And again, within families, if there is a confidant. But again, I'm speaking through policy and interventions within the entire system, that maybe the first approach is trying to understand where they are in trying to make sense of this violation while they were going through the cycle, and finding ways to support them in talking through it and seeing what holding and support is needed from their own perspective. And yes, the state is patriarchal, Terina, but we live under constitutional democracy. And we have to hold the state accountable. And the only way to do that is to go back to the state and say, this is what you said you would do. And these are the resources you've allocated to that. And again, to remind ourselves, in South Africa, we come from a history of the Immorality Act, where all sorts of sex was regulated. So to wake up on the other end of the LGBTIQ spectrum to say we are diverse, we are pink, we are purple, we are BDSM, guys, we're still traveling. I'll leave it at that.
I think I also would like to, you said something about maybe we should not only facilitate this sex education on in schools. We should do it in different community centers. I know there are NGOs that are doing that already in community centers. And then another thing you've mentioned, that if people are dealing with trauma, which you've mentioned, where do they go to? I think as facilitators or as trainers, we need to be aware what our strengths are. Yeah, and I think we need to be aware that we're there to facilitate the process. We're there to give information, but we are not specialists. We're there to say, if you are going through something, we're there to listen, and then we obviously send them to spaces where they can get help. And I know sometimes trainers or facilitators who are working with NGOs, sometimes they want to be everything. And that actually does damage to a young person because you're not skilled enough or you don't have that proper education. So from my part, I'm very happy to be here. I was very happy to be part of the conversation. And sometimes we think we are here to give information, but from your questions, we're also learning. But for someone who's always working in different communities with diverse group of people, I think the migrant communities or the refugees, it's important that we think about them as well. I know that they're already going through a lot in South Africa, and I think in sharing or facilitating that information, we also need to educate ourselves of the communities that we work with, and not to have a blanket training, because it's not always working. We need to be aware who are we working with, and then the outcome, we're going to be reaching our goals. Yeah.
Thanks. I think there's around the question of heterosexism. I think there's an issue also around understanding sexuality, where we think of it as property of the person, which you think of as freedom, the previous comment. And so what happens there, so even for many adults, but certainly for young people, there's many sex acts or sexual relations or forms of intimacy people have that are same-sex, that are poly, that are cross-sex, and we all think of it as playtime as they're practicing towards their adult sexuality. And until you can come to identify as having a sexual identity, I'm a lesbian, all of that is seen as not real sex. And that is, I think, structured in so much of our language and our interventions that we also then normalize property of person and identity as a particular kind of freedom privilege that also then takes away this entire field of practice that not only undermines heteronormativity in many foundational ways, but it means that until you can get a psychologist to help you to your coming out story, everything seems like it was not real. And I think that's a real foundational problem, at least for me. I have a number of therapists I've been in, and they're like, just continue to lie there under him stiff until eventually you become a lesbian, basically, is what my experience personally has been. And I don't know if that's very healthy for anyone. But then the last thing about, I wonder what it would mean for all of us, even in terms of like, what would happen if we were teaching people Tantra? young people. Like, we don't even know it ourselves, i.e. intimacy. When you're talking about being in love with that, you know what it means to look at each other's faces and hug each other without thinking about rubbing genitals. Like, even like the sex act itself is so much of how we think about the body. We're so chopped up in pieces. What would it mean to simply think about, to hold gentle intimacy with each other and to teach that? Just your intimacy with yourself, intimacy, then what does it mean to open up space to have intimacy with another, and the simple basis of I'm sharing space with you? What kinds of other relations? Then you don't have to look away from someone you don't want to be poking inside and then call that, a masculine form of sex. How terrible and violent for you to experience. But that's what people are learning, because you are so dislocated by the time you think that's if that's performing power, then that's terrible, because it's not really a performance of power, and that's got to be very psychologically damaging. And so I think that there's what would happen is, what does it mean I'm going to hold someone's hand and say, I care about you, I care about myself, and I think those are the things that we need to also, I don't know, just my 2 cents.
Thank you so much, and we really appreciate you joining us today. And that actually wraps up our discussions for day 1 of our conference. Tomorrow's day 2. Look forward to joining in sessions around disability, around COVID, and around the work that's done in the University of Pretoria through different departments and other NGOs. So please, can you join us tomorrow at 9 o'clock? And thank you so much, and have a lovely, lovely day.